I'm doing this video today to talk about chronic kidney disease. In short term, we call it CKD. And the first question that I would ask or I would put across is, what do we mean by chronic kidney disease or renal failure? And basically, renal failure is it's more of like a disease whereby the kidney it's not working as it should be working. So that means that it's not working at the optimum. And normally this is a gradual disease. So it's not something that starts just at once. So this is whereby the kidney gradually loses the way it should be working. Normally you tend to find CKD in older people or as people grow older. But my main concern is that you tend to find people, especially in Africa, younger ones are also getting CKD. So you hear that, oh, this person was in their 40s, they died of kidney failure, 30s, 40s, 50s. And the question is that it shouldn't be happening. And typically you'll find CKD because it's very difficult to detect it unless you have these signs and symptoms, which I'll come there quickly. But normally you tend to find it in blood tests, okay? And the typical signs and symptoms that you will find is tiredness, swelling of the feet, the ankles, the hand, shortness of breath, feeling sick, and then blood in the urine. So these are a bit of the few commoners. And the causes of chronic kidney failure, it is quite unsurprising that you always find these dangerous illnesses in everything that I tend to find. You find high blood pressure, you find type 2 or type 1 diabetes, someone with high cholesterol, someone who tends to get a lot of kidney infections like pyelonephritis, and also someone who tends to have inflammatory kidney diseases. And then unfortunately, if you have like inherited family diseases like polycystic kidney disease, sometimes if you have enlarged prostate, someone who tends to get kidney stones, and someone who uses long-term medications like steroids, so non-steroidal inflammatory drugs such as ibuprofen, people who tend to use like diclofenac, lithium. Okay. So what do you have to do to know your kidney function? It's essential that you tend to have blood tests which looks at the creatinine, urea, and also in the renal functions we have sodium, which is not much of it, but we have the kidney functions blood, we have in the renal functions we have the sodium, we have the potassium, we have the urea and the creatinine. But the urea and creatinine are the major cause of it, the major things. And the main treatment for it is that with chronic kidney disease, there is no treatment for it. However, we can relieve the sort of like the symptoms. And most of the times, when you get into we have the stages. So we have the stage 1, stage 2, stage 3, stage 4, stage 5. Stage 1 means no more kidney function. Stage 2 means that the kidney function is reducing a bit. Stage 3 means that it is getting bad, but it's still okay. Stage 4 means that it is getting worse. Stage 5 means that you're completely gone. And normally people within the stage 4, stage 5, depending on their creatinine function, sometimes we have to give them dialysis. It's not even sometimes, most of the time stage 5 is dialysis. And the worst part of it is that once you are in stage 4, it makes it a bit difficult when it comes to treating them, because whenever you are giving patients medication, you have to always look at the kidney function before you try, because or else you kill the kidney, okay? And the worst part of it is that if you are black as well, your risk of developing chronic kidney disease is quite high. And the take-home message that I want to share is that do bloods, because normally you would tend to pick up CKD when you do blood tests. And if you're in your 30s and 40s, do routine bloods. So the routine bloods that I'm talking about is renal function tests, or some people call it UNEs. It is very essential. Off the tangent, it's important to also do LFTs, do your full blood count. Some people call it complete blood count. These are basic blood tests, because if you don't pick up these things, it will give you a lot of problems as you grow. I wish this makes sense and that we are able to look after the kidneys, because these are tiny things at the back but then it does wonderful things. And the abnormalities when it comes to CKD is that because it takes years to pick up, if you don't do bloods, sometimes we don't pick up on them. And if you have persistent, I can never overemphasize this, persistent high blood pressure, look after it, treat it, take medication. Especially people from Ghana, you find people taking sobolos and gingers and all those kind of stuff. And always I tell people that, look, I'm not saying it doesn't work, but if it had done wonders, then people should never have high blood pressure or diabetes from where we come in from. So look after yourself, take medications, take treatments, and you will live longer. God bless.